Here are 5 reasons why you should move on from Benadryl that you may not be aware of. I'm a board-certified allergist, and if you want to know more about allergies, asthma, immunology, feel free to hit that follow button to learn more information. Benadryl is a first-generation antihistamine that's commonly used to treat allergy symptoms as well as allergic reactions, and it's been used for many, many years, and people recognize that brand name and think it's the first thing that you use to treat allergy symptoms when there are a lot of things that are problematic with that drug. At number 5, Benadryl is a medication that can easily cross the blood-brain barrier and cause sedation, and it's been associated with increased risk of motor vehicle collisions to the point that in Europe they classified Benadryl as a class 3, which is the top tier, as a medication that you should not be driving with. Pilots in the United States are not allowed to take Benadryl within 30 to 60 hours of flying, depending on the dose that they take, because those sedative effects can last for that long. At number 4, there's a misconception that Benadryl is the fastest acting antihistamine used to treat allergic reactions, when in fact the newer second generation antihistamines such as Zyrtec, Xyzal, and Allegra, they work just about as fast or even potentially faster in some situations. At number 3, about 10 to 15% of people who take Benadryl actually have paradoxical effects, known as paradoxical excitation, where you can actually get hyper and aggressive when taking it. The theory behind this is that some people may be super metabolizers of this medication, and so some of the byproducts may cause the brain to become excitable. At number 2, multiple studies such as this one have shown an association between taking anticholinergic drugs in adulthood and the development of dementia later in life. And so Benadryl, as a first-generation antihistamine, also has anticholinergic effects, so this medication potentially is associated with the development of dementia. Second-generation antihistamines, these newer ones I've talked about, do not have anticholinergic effects, so this concern is not seen with these newer medications. And at number 1, which is a continuation of number 2, we know that Benadryl has anticholinergic effects, and if you're not familiar with what that means, there's other effects that it can have on the body, including the following mnemonic: can't see, can't pee, can't spit, can't shit. And your mucous membranes as a whole can dry out, so it's not just those parts of your body, but also your reproductive tract as well, which could potentially lead to sexual dysfunction.